Hello everyone, in this video we are going to talk A to Z about previous year questions. So if you are giving any exam, any sort of exam, be it NEET PG, be it INICET, be it FMGE, be it NEET UG or any sort of exam in India or be it in the world, you need to practice the previous year questions because it is one of the three pillars of success. First one is practicing your revisable notes, second one is giving more and more grand tests, and third is practicing more and more previous year questions. The first two videos are already available and I am giving the link in the I button also so that you can view it, and the third video is finally out. Sorry, I am a bit late because of many reasons. As you can see in my face, these are not acne spots. I am having chicken pox, so I am in home isolation, but I have recovered from my fever, so I thought to shoot this video for you because only 2 months are left for NEET PG now. So let's start the video without any delay, and I have divided the video into 5 sections. If you require a particular section, then you can directly skip onto that section. Why are solving previous year questions important at all? Now coming to the first point, that it gives you idea about the pattern of exam, what kind of questions are asked. Like in QBank, you see some questions are of 10 to 20 lines, some are of 1 line only. So it gives you a balanced idea that how are questions actually asked in the exam. Number 2 is that you get to know the important topics that the exam focuses on. And number 3, in my NEET PG experience also in NEET PG 2023, I got about 30 to 40% direct previous year question repeats or previous year related topic repeats. So it is a very much, I would say, very much high yielding material I felt for NEET PG. So you should always practice the previous year question, and if you don't practice and go to give the NEET PG, then it's really very difficult. From where to practice previous year questions? Among all the platforms to which you have subscribed already, you can practice the previous year questions from that platform only. But if you want a good platform, then there are 2 good platforms available, I would say, that is Marrow and PrepLadder. Their solutions are decent and their explanations are perfect and the recall is also fine. But there are many other platforms which don't give the accurate answer, and if in this case our answer is wrong, then that creates a mess in your rank if the same question is asked in your NEET PG or INICET exam also. Now many are talking about the Reflex app also because it is at a very reasonable price and many years of previous year questions are given, about past 10 years are given. But I would say that Reflex app is very much cost effective, but some of the questions answers were wrong. I have seen like 2 to 3% of the answers are wrong, and that can impact you massive because if the same pattern of question comes, then one mistake means about 200 to 300 rank at least you would set back. So that creates a lot of mess. Choose judiciously which platform you are choosing for solving the PYQs. The next question that comes, how many years of previous year questions we should solve? You should solve for NEET PG at least past 5 years of NEET PG and at least 3 years of INICET questions. If you are for FMGE, then at least 3 years of NEET PG, INICET and FMGE. And if you are going for INICET, I would give a dedicated video on that, how to crack INICET. Okay, so don't worry for that. I would give you when the time comes. And if you have done all the 5 years and 3 years things what I have spoken, then you can practice the previous year questions also that are left for you, because solving would boost your confidence and it would enhance your knowledge. So solving more is always beneficial, I would say. How to solve the previous year question? Now I have given a live demonstration to you after this video only, so check the demonstration.
Hello guys, जैसा कि मैंने तुम लोग को बोला कि you can follow PYQs from either Marrow or either PrepLadder, okay? बट आई हैड सब्सक्रिप्शन ऑफ प्लान बी ऑफ मैरो. सो मेरे पास अभी वही है, वही मैं दिखाने जा रहा हूँ. तो आप देख ही सकते हो कि मेरा प्रो प्लान अभी खत्म हो गया है बहुत दिन पहले ही. सो इट्स सेइंग गो प्रो, बट मैरो गिव्स एक्सेस टू सम ऑफ द PYQ सेट. सो आई एम शोइंग यू फ्रॉम मैरो ओनली. सो क्यू बैंक में जाते हैं. क्यू बैंक में जाने के बाद में वी गो टू द प्रीवियस पास्ट ईयर क्वेश्चंस. ओके, सो हियर इज अ ब्यूटीफुल थिंग दैट हाउ मच percentage you have got correct, that is shown, and you completed on which date, that is also shown.
So let's review anatomy INICET 2021. So here is a schema given. Okay, means which all topics the question has been asked. So it is useful, I think, for knowing the previous year topics. Now review. See, my first question has gone wrong. Okay, so I would read the whole of explanation why it has gone wrong. Now coming to the second question, you would have better idea in the second question, so I am explaining the second question. So you can see a 12-year-old boy presented with fever, difficulty and swallowing. He was advised to undergo post-surgery. Surgery means he had acute tonsillitis, after which he underwent tonsillectomy. So post-surgery gauze was soaked with blood. Now what could be the case of hemorrhage of tonsil? So we know that it is the paratonsillar vein that is most commonly involved in bleeding of tonsil after tonsillectomy. The specimen, the images of tonsillar fossa and the clinical given vignette is suggestive of tonsillitis. What I said, post-tonsillectomy hemorrhage is most common from paratonsillar vein. So if you know that most common site is paratonsillar vein, then only you can get the question correct. But I want you not to stop here. Read whole the explanation. Okay. So it was asked about which is the most common artery of hemorrhage, but the branches they have mentioned, they are blood supply of tonsil only. So you need to know about each and every option. So they have given the arterial supply, the venous supply also. As it was asked about hemorrhage, so they have given the primary hemorrhage, reactionary hemorrhage and secondary hemorrhage. Means they have given the classification of hemorrhage and their causes. After that you can see an image of tonsil and its blood supply, which is not much necessary, I would say, because asking a question showing this image and marking a point that they are giving this point and making it blank, what artery is this? Lingual artery. So this is very unlikely. If can occur in INICET, but this is very unlikely. Okay, so this image is not that much important, but this relation of tonsillar bed is very much important. So regarding this, if you don't know anything, or if you don't have the classification of hemorrhage in your revision notes, any kind of revision notes or the notes you are following, then take a note of that. Okay, take a note of that, because in previous year question, as I said that the previous year question is not just important, the topic is important. So Marrow and PrepLadder are platforms that invest very much in developing their previous year question modules, and they have a great team. Means I have also worked in the team, so I know that there is very much error free, and they bring very much important topics only that you need to know. So you need to know the whole explanation. If any point is missing, then add on to your notes. Now coming to bookmarks, see, yeah, here are 37 bookmarks. Previously it was, and all the bookmarks I have kept are of the previous year questions only. Okay, I have removed all the QBank bookmarks. So in the bookmarks there are 37 bookmarks now. This is the end. So in the end it was 37. It is 37. But previously when I started, the bookmarks were about 400. Then it reduced to 200. Then it reduced to 50-60. Then in the last day also I reviewed, and there are 37 bookmarks only. So let's see one of them, pharmacology. So if you click the bookmark, then you get the, if you click the bookmark, you get to solve the question, and the timer starts ticking. So what would be the answer? I know the answer is 4 only. So yeah, it's correct, and it would, you would get the explanation again. If you are getting it wrong again, then see the explanation again. Okay, so like this you should practice the bookmark, and if you are confident that after getting it correct, then you should funnel it down.
The funneling, I use the prep ladder app also. So the Q bank is here, and there is an extra point in prep ladder Q bank that there is blueprint. See, 2500 key repeated topics of all modules. So they are giving the repeated topics. So see, ABCD2 scoring 3 times it has come. Abdominal muscles 1 time it has come. So you get to know the previous year topics also, important previous year topics, and this is a very much great feature, I would say. See, in ABCD2 scoring system, if you click, I don't have the pro subscription, so all the 3 questions that has been asked in the previous year question you can get. So if you are going topic wise, that I have following this topic, so if you are going topic wise, then this feature is very much useful for you, I would say.
Now coming to the last part, how to remember your mistakes or the take home points of the previous year questions and the previous year topics. So for that, number 1 you should do is, in which you are getting mistake or you don't have the clear concepts, you should just bookmark the questions on the app itself. Now in the first time you would have about 700 bookmarks. Now you should reduce it. The technique we call it is the funneling technique. Means in the first go you are marking 700, in the next go you are marking about 300, but at the last it should reduce to about 50 questions. Okay, like this, if you funnel down and revise it multiple times, the bookmark questions, you are going to remember the points. And the number 2 point that you can do is annotating the extra points in your revisable notes, the notes you are reading. Then whenever you revise the notes, you would get the points already and registered in your mind. And you can also do is highlight the points, then your eyes would go and struck directly into the main points, like I have done in my notes. You can see this is up for today. And if you like this video, because देख रहे हो कि मैं चिकन पॉक्स होने के बाद भी वीडियो शूट कर रहा हूँ, तो सब्सक्राइब करना बनता है बॉस। जैसे करके तुम लोग प्रीवियस ईयर क्वेश्चन का करेक्ट आंसर को टैप करते हो, वैसे भी मेरे नीचे वाला लाल बटन में यू जस्ट tap it. Okay, and see you, bye bye, goodbye, all the best.